So I'm not saying this just because you're right here in front of me, but when I look over the past 2 years, seeing you start fellowship here, getting to work with you as a resident, just seeing the way you conduct yourself, the way you interact with patients, the way you handle challenges, um, it's exemplary. And it's honestly an example I look at for myself to follow when I start fellowship or even as I enter this final year of training. You're at a point now where you've done residency, you've done fellowship, you've worked with plenty of residents. What are some things that you feel like residents can do to either make more of their experience in training or for fellowship? Uh, and what do you think that the residents don't necessarily do a good job of that you feel like they could be taking more advantage of their time in training?
Yeah. Well, this is without answering the last part of that question. Just in general, what you can do. I think empathy and trying to figure out what people actually need is crucial in order for you to get by successfully. Because I realize that most of the time, whenever there's a conflict or an issue with either a patient, a staff, or resident or ancillary staff, it's a problem with communication. And it's a problem with either the resident or the intern or maybe the staff member just not being able to figure out what people were trying to convey. And then the message just gets distorted and taken the wrong way. So if you just sort of sit back and just try to understand why they're angry or what they're trying to say, and it sounds obvious, but it's really not. And with patients, this happens all the time where they come into the office and they're super angry. And it's really easy for you to just be like, why am I getting yelled at? I haven't done anything. And then just not necessarily lose it, but just not go that extra 10% to try and make them feel a little bit better and just diffuse the situation. And it ends up saving time. Patients are happier. You are happier because it's not nice to be angry. I mean, it takes a lot more energy to get angry than to try and diffuse the situation.
Absolutely.
But not everyone realizes that and they just get angry and it ends up taking up much more of their time. So I think just sort of one is empathy, but also just trying to understand what people need at that time and why they're acting that way is something that has helped me my entire life just to get through tough situations. So that would be something I recommend. But I'm not saying that the residents don't do that. So that's why I specified that.
No. That's what I was talking about. I wasn't even referring to our residents in particular, just kind of in general. But I agree with you 100%. I've had this idea floating around in my head now, or just the sentiment for the past several years, which is so many conflicts in life, so many hardships could just be avoided or prevented if people were just better at communicating. And we take it for granted. Like, oh, I know how to no one wants to say they're a bad communicator or that they lack.
And it's also a problem with like sort of insight, right? People don't necessarily think they're bad communicators because how would you sort of know that, right? Unless you have trouble just getting words out, right? But it's tougher to realize than one would think.
Yeah. And when I look at patient interactions or interactions with staff or physicians with patients, just in the medical sphere, and then even outside, just in day-to-day, everyday life, when you go to the cafeteria and interact with people you meet there or just down the street, so many things are just reliant on communication. And as human beings, that is at our core.
Right.
And I think, so how would you recommend someone improve their empathy or improve their communication skills? Like, it's not an easy task.
It's not easy. And honestly, I'm not sure how to answer that appropriately. But one thing I would recommend is just taking the time while you're in a difficult situation and sort of take those extra 3, 5, 10 seconds and try to figure out why things are going the way they are as opposed to the way you expect them or had expected them to go. And just sort of tweak what you're saying or doing. And just that's kind of how I try to approach and diffuse a situation when it presents. And it presents a lot more frequent than you would think.
All the time.
And patients are really anxious, rightfully so, about their eyes. And whenever something does it, and the same way that other doctors in medicine have very poor understanding about the eyes, and I'm not talking everyone, but just in general, patients have even less understanding about what's going on with their eyes. And it's really frustrating and really anxiety inducing because they notice it right away because, well, they can't see. So educating them is very important, and just reassuring them, and you tell them something, but when people are anxious, they only listen to half of it, or they're thinking about their anxiety and how they're going to go blind, even if it's true or not. And they don't listen to half of the stuff you said. So even when you tell someone something, sometimes it just needs to be repeated in a different way, or, from a different approach, or from a different sort of emphasis or point of view, uh, to get it, to get your point across.
Yeah, no, I agree 100%. You can have someone who's the best teacher in the world or the best orator or communicator tell you something 1,000 times, but if that's just not the way you receive information, or it's just not the
Right.
way it takes for something to click for you, sometimes that's all it takes. Someone else to come in, or a different
Right.
approach, or taking 10, 15 seconds to take a step back. I like to, a lot of times, just pull up Google and
Mm-hmm.
go to Google Images and just pull up pictures of
Yeah.
pathology or the eye and show it to patients. Because a lot of times it's very hard for them to understand
Right.
early stage glaucoma if it really hasn't affected their vision too much, or the beginnings of diabetic retinopathy that maybe haven't affected their vision. And,
Right.
and you're trying to explain to them the importance of, whatever, managing their eye pressure or their blood sugars. Yeah, I don't have a good answer to that either, apart from just trying to be diligent and trying to improve. I think a lot of it is also, and when it comes to empathy, is what are your life experiences like? Like, did you grow up always kind of in the same social circle? Did you
Right.
have very life experiences? Have you lived in a different country? Have you been around people who are, upper class, middle class, lower class? I think just the whole breadth of a person plays into
Right.
that. And yeah, I mean, if you don't want to improve, or you're not even aware of the issue, it's hard to do that.